Hello, I'm Dr. Karim Kurji, York Region's Medical Officer of Health. As you have heard, we are experiencing a record number of cases in York Region. In fact, if you go to our website, york.ca/COVID-19, and you go to the Times and Trends section, you will see a graph that compares York Region to neighboring municipalities. Our incidence rates are now higher than those in Toronto, and we are second only to Peel in the province. So where are these cases coming from? They seem to be mainly the close contacts of cases, and they seem to be within households, more so associated with recent family gatherings, and also seem to be close contacts of workers in the large manufacturing plants and in the industrial plants. In order to be able to control the spread, we are resorting to electronic tools, including something that we call the virtual assistant. The way it works is that our cases receive a text message, and they are guided to a questionnaire that they are urged to fill out. This questionnaire is used by our case investigators to identify close contacts, and these close contacts are reached expeditiously in order to prevent them unwittingly spreading the infection to others, including their household contacts. So we urge you to assist us in this process. We have long since believed that many of these cases have been introduced into York Region as a result of travel, both internationally and across the US border, since the US has the largest outbreaks in the country. We know from having investigated some potential cases of the variant that the quarantine isn't being practiced properly. For example, there was one individual who had traveled from Germany to another city and then to Toronto who had no contact with a federal quarantine officer. Likewise, we had another individual who, after traveling from the UK, had a family dinner. This isn't the proper way of practicing quarantine, and we urge every person who is supposed to be going into quarantine to go into self-isolation for 14 days. I also want to remind you that it is now a requirement to have tested negative within 72 hours of boarding a flight to Canada. And this is something that folks should be aware of. Of course, there shouldn't be any non-essential travel in the first place, and we hope that our residents will abide by that. The good news is that we have 2 vaccines now. The province has, through its prioritization plan, prioritized long-term care residents, staff working there, and essential caregivers, together with high-risk retirement homes and the staff working there, as the highest priority. We are working very closely with our hospital partners, with York Region EMS, with physicians from the community, as well as other partners, in order to be able to immunize rapidly these priority groups. The reality is that there isn't enough vaccine for everyone at this point. And as vaccine supplies become available, we will be advancing through those priorities. So I urge patience for everyone. There will be enough vaccine for everyone. It's a matter of a few months now, maybe a few weeks if new vaccines come onto the horizon. Finally, I'd like to remind you all about the precautions we have to take. Physical distancing, wearing masks, washing hands regularly, not going out if you've got mild symptoms, going for testing if you've been in close contact with a case, staying home as much as possible, not mingling with anyone other than your immediate household, and not traveling abroad unless it's really essential. Also, we hope that you'll assist us with respect to responding to our text messages and filling out the questionnaire. We still have to be very vigilant about following public health guidelines. Vaccines will be available for everybody within a few months. Until then, please be vigilant and stay safe. Thank you.